Opting cryolipolysis, you're a little bit in pain. So what happened during the procedure is they applied the handpiece on you. It was freezing for the first 7 minutes. It's like frostbite initially, and then suddenly the pain goes away just like that because the nerves are just dissipating with the frostbite. So you've got to just withstand the first 7 minutes, and then afterwards you can watch a movie, you just chill out, you go to sleep wherever they're doing it here, on your abdomen, on your back fat, in your bra puffs, in your inner thighs, outer thighs, wherever they're doing it. The smaller the area, the more painful it is. You know that we do give some analgesics, some painkillers for smaller areas like here or the bra puff. So once they take the applicator off, it's a little bit more painful. So it's painful for about 2 to 4 minutes, and it's tingly pain, that sharp, stabbing, tingly pain. And what they're doing is they're massaging out to make sure the fat cells are going to dissolve and disperse uniformly to give you that silhouette or that contour that you would like. So you've got to let them massage you out. You've got to breathe through that pain, switch off, meditate, do whatever you need to do. They'll apply some ice pack in that to cool you down as well afterwards. And then you're fine. You're literally fine to go home. You're literally fine to go out. You can go party, you go back straight to work, go to the kids. So that's the good thing about Adipem or cryolipolysis. You can get on with your day. What you will notice, you need to follow the Aftercare down to the T, but the tips I give people, because you know, I've been officially banned from the machine because that's my gym routine. So what I tell people is basically massage the area yourself a couple of times a week if you can, and work out. Like go on a treadmill if you're working out, or if you're just walking on an incline, even if you're just walking around. The more mobile you are, the faster your metabolism is, the quicker the result will show. There's always a risk of swelling. So if you're planning to do it before a beach holiday, do it 8 weeks before your beach holiday, because you're going to be swollen in your abdomen over the next couple of weeks, and you're going to think you've put on weight and you haven't. It's swelling, especially in the abdominal area or the stomach area. In the lateral thighs, there's a long nerve called the lateral cutaneous nerve of the thigh. It tends to shrink down with the cryolipolysis technique. And what happens over the next couple of weeks is it re-innervates. So you will find some numbness in some area, whether it's your abdomen, your lateral thigh, your inner thigh, here especially. You will find some numbness, but the nerves will come back, the sensation will come back whilst the fat loss is dissipating. The other thing is a risk of bruising. There's always a risk of bruising. High risk areas of bruising is here, and then in the lower flanks. Other areas don't tend to bruise as easily, but this is a high risk area of bruising. So again, do not do it if you've got an event the following week. Do it a few weeks beforehand. The other thing is just enjoy it. You're going to see the results. We normally say at 8 weeks, but people start seeing the results at 4 to 6 weeks. It is not an excuse to carry on eating shit. So just because you've had the treatment does not mean you can keep doing this. So this is a kickstart to get the silhouette. We're contouring you on the outside. You've got to do the biohacking, kickstart your metabolism, or do whatever you do on the internal fat loss as well. Any questions you have, any concerns you have, always contact the LMS concierge team or contact your aesthetic lead, and we can answer them for you.